Good morning, everyone, and welcome to the virtual version of the Leadership Austin Engage Breakfast series. I'm Judy Maggio with Austin PBS. I lead our Decibel news team, and I wish I could see all of your smiling faces this morning, but we know you're out there, and I'm certainly delighted to host such a vital community conversation this morning. We are all living through unprecedented challenges and changes in our lives. The way people band together in response to disaster can really be a key factor in how a community recovers. Cultivating community resilience should involve targeted strategies to support people who are most profoundly impacted. So today we want to explore a very important question, and that question is, what are the regional, economic, health, and social consequences of this pandemic, particularly for communities that are historically marginalized? So before we begin and introduce you to our panel, I want you to meet someone who's very important to this discussion, and that is Courtney Bailey. Courtney is the program lead for Engage Breakfast, and she is the Director of Issues and Engagement. Good morning, Courtney. Director of Issues and Engagement at Leadership Austin, and she really is your virtual voice today. She's going to be fielding your questions. So we want to tell everyone that this live stream is being shared on both the Decibel ATX, that's our Austin PBS News Facebook page, and also on the Leadership Austin, Leadership ATX Facebook pages. And that's where you're going to be putting your questions in the comment section of either one of those pages, and Courtney will be able to see the comments and ask those questions of our panel this morning. So let's meet our panel. First of all, we have Quincy Dunlap. Quincy is the president and CEO of the Austin Area Urban League. The Austin Area Urban League's mission is to provide tools and services to African Americans and underserved populations to build a foundation for social and economic equity. Then we have Mark Hernandez. Mark is the medical director of public health alliances at Ascension Seton. Ascension Seton is the largest nonprofit health system in the U.S. and the world's largest Catholic healthcare system. And Carmen Llanes Pulido. Carmen is the executive director of Go Austin, Vamos Austin, better known as Gotha. Gotha is a coalition of residents, community leaders, and nonprofits working to improve the health of communities in Dove Springs, South Austin, the Runberg area, and St. John's neighborhood. So thank you all for being part of our panel this morning. And thank you all for all the wonderful work you've been doing in the community for a long time, but in particularly during this pandemic. I'm going to start with a question for everyone. So whoever wants to jump in first, go ahead. Actually, why don't I assign someone to jump in first? I'm going to assign this one to Mark to start first, so we won't have that Zoom everybody talking at once issue. Your organization's role in the community is important, especially now. So I want you to kind of provide a reflection on your leadership during the last 2 months when we've been facing such difficult, challenging situations. So Mark, you're going to start on that one. Go ahead.
Sure. So Ascension Seton has been a long time member of the Central Texas community, providing healthcare for more than 100 years in this area. But nobody who's working for Ascension Seton today was here during the last pandemic, which would have been in 1918. So, you know, we don't have any individuals handy who can give the first person account of how we handled this last time. I think for us, it is really about making sure that we are all hands on deck to make sure that the community is able to deal with the health effects of this pandemic. You know, we are healthcare providers, and that puts us front line at helping take care of people as they are affected with this illness. So as a result, our hospitals immediately went into a plan of how we would move patients around so that we could make sure that the expertise in taking care of people with COVID-19 was paired with where the patients were showing up. We, like everybody else, cut down the amount of elective procedures that were happening in our hospitals because that was not only mandated by the government, but it was the prudent thing to do. We didn't need to be bringing people into healthcare facilities at a time of pandemic. But it's also been a learning for us on how can we better serve those people who have historically been underserved in our community from a variety of spheres, but healthcare is certainly one of those. And that has long been our mission in this area. We have worked hard to figure out how to project healthcare into those areas that are underserved. This has given us both the lack of regulation, or the reduction of regulation, to allow us to really get out there and be able to help people where they are. So I think for us, it's really about how do we make sure that people get the care they need.
Quincy, talk about your organization's role during this time and reflect on your leadership.
Thanks. Thanks, Judy. Part of what the Urban League has historically done is always have a response for the community. We focus on 5 areas: health and wellness, education and youth development, housing, workforce development, and justice and advocacy. And we were already developing a response model, and it just so happened that this COVID-19 coronavirus thing breaks out, and it gives us the opportunity to serve on a deeper level. We already were providing some of the utility assistance and rental assistance, mortgage payment assistance, medical assistance in the form of co-payments and prescription assistance. But this gave us the opportunity to ramp it up, and the city came to the table to support. So historically, we have always been there to serve the community across the country, but here in Austin and Central Texas, the Austin Area Urban League focused on the Travis County and the other 5 or 6 counties that contiguously touch Travis County. And we have not always been as mobile as we are now. So it's making sure that the services that we have, we meet the people that need our services where we are. We have a value proposition that we bring individuals like ourselves on this call who have access to resources and opportunities together with individuals that don't. And we build a bridge and make a connection to improve quality of life. So that's our value proposition. That's what the Urban League intends to do during the COVID-19 crisis, is how can we improve people's quality of life or mediate or mitigate deterioration of their quality of life. Oftentimes in normal circumstances, underserved, under-resourced, marginalized communities are excluded. In times like this gets exacerbated. So we had already started to move and form coalitions to ensure that the right resources and opportunities got out to the community, because that's historically the work that the Urban League has done. But this gave us an opportunity to dive deeper and be more service oriented. Instead of, we have a brick and mortar building, but this is one of those opportunities where by design, you can't go into the brick and mortar because of social distancing, and you have to get out and with the PPE, and you have to get engaged in the community and provide resources in ways that traditionally nonprofits haven't. This is an opportunity for human service at its best. And anybody operating a human service organization right now should be celebrated. So again, my colleagues, I commend you for the great work that you're doing. Leadership Austin, thanks for bringing us together. And the Urban League is here to serve, and we'll continue to serve.
Wonderful. Thank you, Quincy. And finally, Carmen, let's talk about what Gotha's been doing for the past couple of months during the pandemic and reflect on your leadership.
Thanks so much, Judy. It's great to be here, and great to be among so many of you virtually who are responding in real time to what we're all going through. Gotha organizes and mobilizes community power for health equity, and we have been really leaning into the networks that we have with people across the communities that you mentioned in South and Southeast and North Austin, but also with all of the institutional, community, and organizational partners that we have across Austin, in terms of understanding how this crisis is impacting the communities we work with every day, where the disparities are, but also where we can respond really quickly. And so we accelerated a few projects, we've adapted others. We've been working a lot on climate resilience and reducing the risk of flooding and community response to that. And so this, in a lot of ways, we're in a drill right now. We're living crisis response. And we also need to stay prepared for what's ahead, because things like flooding and climate risks don't stop because we're in a pandemic. But in the immediate response, we accelerated a food distribution pilot in partnership with Urban Roots, where we brought the residents together who have been working on food access, as well as people who were in immediate need of food all of a sudden because of this crisis, and people who were out of work but had food handling experience. And we leveraged our networks, our relationship with the Austin Public Health Department, and got safe protocols to get produce immediately distributed to 20 households, and that's growing. And we've also been extremely involved in direct cash assistance, mobilizing for public and private funding to get direct cash payments to people so that they can cover immediate needs, but also keep the economy going. We have to remember that none of us in the nonprofit sector exist without the communities that we serve. So we have to make sure that they get through this. Excuse me. But more broadly speaking, in our economy and our recovery and our public health as a society, we depend on people being able to get through this crisis in basic ways. And so it's been really amazing to see how people in every neighborhood and every community step up to support each other, to get each other through this, and how we as networkers can support that work along the way.
That community connection has really provided, I think, all of us with more hope moving forward. The next question, and Quincy, I'll have you start on this one. Just kind of give us your perspective on how COVID-19 has shined a glaring light on the systemic inequities that exist in Central Texas.
Well, it's funny because the city of Austin markets itself as this very diverse place. It's a tale of two cities. There's an underbelly here that exists. And I don't necessarily think that you don't want to market that type of thing, but there's a kick the can down the road type of thing when it comes to those individuals in our community who need support and assistance that should be provided in a way. One example is the back and forth about where to place another homeless shelter. There should be 4. There should be north, south, east, and west. So when you talk about the society and the needs of the people and how to serve them, it shouldn't be not in my backyard. There shouldn't be NIMBYism. It should be, there are appropriate spaces for this all over the city. And how do we come together to make the decision to serve? When we talk about inequities, you have people, according to the 1929 plan, if you live here and you have never seen it, you need to go to the library or Google the 1929 plan to see how this city was structured and who it was structured for. And you also need to take a look at how gentrification happens and how points of connections are to how gentrification happens. I'm being broad in discussing inequities. Even in the hiring practices of some corporations, this is probably the second or third largest tech sector for the country, yet these companies here still have diversity in there, still have problems in the diversity hiring practices. So when you look across the spectrum, it's ridiculous to think that in 2020, we're still having discussed companies only having 4% minority hiring in their company, 4% or less. We're still talking about over policing in a city to where we represent 7 to 9% of the population, but 30 or more percent, if I'm remembering the numbers correctly, we represent that amount of arrests and stops for Black and brown people. It's ridiculous to think that right across from downtown Austin up under the highways, the highway overpass at 6th Street and some of the other underpasses, there's a whole homeless city. And we do nothing to offset that. And we want to knock down the camps and their housing. without giving them opportunities and options. Something is off about that scenario when we talk about inequalities and inequities. There is not parity and quality of life in this city. And until we have a real discussion and we stop having the fear of upsetting one group or the other, equity requires that a group may have to receive less because historically they have received their fair share so that others can be brought to parity. And I just see political paralysis when it comes to making those tough decisions because people want to get reelected. Well, you get elected to serve the people. So when we talk about inequalities, we have to have a real conversation and be fearless and uncomfortable in that conversation. And until we do that, inequalities, inequities, and lack of parity will exist for certain communities that historically get marginalized.
Yeah.
Yeah.
So let's, and these are great. You've painted a great broad picture for us about the inequities that exist in our community right now. So Carmen, what I'm going to ask you to do is get a little bit more specific about how perhaps the pandemic has magnified a lot of the things that Quincy was talking about that you're seeing in your work.
Sure. I mean, well, I think first and foremost, we have to understand, we have to learn from history. And as Quincy laid out, we have a racially segregated history. And we need an intersectional analysis when we come and when we look at the history of our community and we look at the disparities that we're seeing now that cut across income, that cut across gender, that cut across ability, and all these different isms that we deal with, and understanding that race is a primary axis. So when we look at the data right now about who's getting infected with COVID at the highest rates, I just read KUT's report that Latinos, Hispanics in Austin are twice as likely to be hospitalized if infected with COVID. That's for a number of reasons. The alarming disparities in African-American death and disability that is arising from this virus. And also disproportionate exposure, just because the frontline essential workers, many of them are people of color. And then we look at underlying risk factors associated with the implications of COVID-19. And Southeast Austin, where Gotha is very active and has been organizing for a long time because of the disparities in chronic disease, we see a lot of those underlying risk factors. So those are ways that it's very specifically hitting. You're telling folks to shelter in place, and we have a tremendous amount of people for a variety of reasons that will not benefit from the stimulus package, that will not benefit from the CARES Act, that may not have the kind of safety nets that allow us all to go virtual. And it's all the communities that kind of disappear. In the words of another community organizer in town, Paula Rojas was saying, when we all go virtual, everybody that you don't see, those are the communities that we need to be looking out for. And so that's why networks and relationships and trust are so critical right now, because we see what the data is showing us. And it's getting into the conversations around recovery too. Who's getting small business association loans? Who's getting support? Which organizations are getting funded and with what kinds of strings? And we need to be tracking all of that so that our response can be equitable.
Mark, Carmen started a discussion about health disparities, and I want you to expand on that because this is your area of expertise and the things that you are seeing every day. We understand that some of the disparities are being underreported since some of the communities, about some of the communities that are most impacted. So what do you think these the disparities look like from your landscape, and how are they impacting some of the most vulnerable communities right now?
Yeah, so Carmen actually touched on a whole bunch of the important healthcare pieces. I'll try to offer a little bit more color to that. I think that if you think about the way that the federal government and then the state government and then the local government has each on their own had to figure out how they were going to respond to this pandemic, and then overlay that on top of the marginalized or the poor and vulnerable populations, however you would like to characterize those individuals. I think what you'll find is that overall, at least from the federal level, and I'll just get out there and probably be in trouble later for saying it, the federal government's response has been fairly chaotic and hasn't been very organized. You know, and that's for anybody and everybody who is at risk of this pandemic, which is everybody. Everybody is at risk for getting this virus. But the challenge is that for the marginalized populations, they were already kind of under the bus with this. Healthcare wasn't getting to them anyway. They already had, in some cases, distrust of the healthcare system and weren't going to engage the healthcare system in a way that was best for their health, because we hadn't created those relationships that allows them to be trusting and to come in. They are, as Carmen pointed out, in many cases, individuals who have to go out there and earn a living. Whether they got the $1,200 or not, that probably is not going to keep you at home fully socially distanced, because $1,200 doesn't go very far. And so for those people, whether they got it or not, they've had to continue to be out in public, working their jobs and being exposed. And then when you overlay on that the fact that we have not been able to test for this virus with any sort of an effective strategy, like it is only recently, like within the last week to 10 days, that I've heard reports that we're now beginning to test people who are asymptomatic. And by testing, I mean testing them to see whether they are currently infected with the virus. So not antibody testing, not historical testing. I'm talking about testing somebody to see whether you have the virus today. We haven't offered that testing to anybody who wasn't having symptoms. You have to have symptoms in order to get that sort of testing. Well, the reality of it is, for people who are having to go out and interact with the public constantly, we needed to be testing those people early to figure out who might be carrying this virus, and to be able to give them real instruction about, we need to get you quarantined. We need to support you in that quarantine, however that support needs to be, whether that's quarantine at home, whether that's quarantine in the isolation facility that the city funded. But we need to make sure that you have an opportunity to get well and get over this virus, as opposed to continuing to go out into the public and spread it. But we haven't been able to do that. And we certainly haven't been able to do that for this population. And so as a result, you know, where is the disparity? The disparity is the people who are most likely to get infected with this virus, because of socioeconomic pressures, are the people who can't get tested, don't have the money to request a test, even if they wanted it. And to a large part, the people who have been able to socially distance, I hate to say it, a lot of people have been at peace with that, because they're not at personal risk for contracting this virus. They've been able to socially distance. They haven't given much thought to the people that are out there kind of keeping the trains running, and supporting us when we decide we've got to go to the grocery store and buy groceries or those sorts of things. We've not given a lot of consideration to the people that are out there making minimum wage so that they can keep their apartment, so that we can have groceries, which is what this kind of turns into. So, you know, I think there's, the disparities are deep. I think people have not responded to other medical issues. We've seen a 40 to 50% reduction in the people coming to emergency rooms locally with heart attacks and chest pain. Well, I can promise you that those heart attacks, that those cardiac problems, they didn't just all stop as a result of the pandemic. It's that people are not choosing to come to the hospitals. And, you know, our own data, we know that that population is way overrepresented in people of color. Those are the people that we see, and yet they're suddenly not coming. Well, what that means is that we're probably going to see excess deaths in that population. We're going to see excess disability in that population from people who have their heart attack at home and don't receive care and end up with heart failure as an ongoing problem. People aren't coming in because their diabetes is out of control and are essentially hurting themselves in the long run. I think we're going to be digging out from the effect of this pandemic on this population for the next several years. I don't think we'll understand the full impact of this pandemic on the health of that population for the next 5 to 10 years.
There are so many layers to peel back on this thing. And I think you're right. I think we're going to be peeling those layers back for a long time. I want to check in with Courtney Bailey for questions from the audience. I know we have a nice size audience out there watching. I also want to remind everybody that if you do have a question for the panel, to please type it into the comment section, either on the Decibel Facebook page or the Leadership Austin Facebook page where you're watching right now. So Courtney, what are some of the questions from the audience?
Thank you, Judy. I have a good question. So at the start of the pandemic, there were several funding streams that were opening up, including the City of Austin Rise Fund and the Altogether Texas Funds. What are your thoughts on the current structure and process of these new funding streams? What's working and what's not working?
I'm raising my hand on that one.
Okay, Quincy, take that one first.
So let me first commend the City Council, the City of Austin, and Austin Public Health for even having a response. They chose to put some emergency funds together and come to a couple of community-based organizations / nonprofits that they felt could respond immediately. But the thing that we have to understand is the bureaucracy moves a certain way. And there's the information put out that the organizations that got the RISE funds, that information was put out, but the structure and understanding of how that was supposed to operate on the back end administrative side of it and programmatic side of it, that didn't happen. So it forced us as the lead cohort to respond, put together resources, and have an immediate response before the bureaucracy could move to do the things that they needed to do. So I want to just caution the public to understand, yes, you saw the media press release, but there's a whole nother side to getting you guys served effectively and supporting our brothers and sisters that's on the ground doing the work and receiving the services. So it's just not one day you see the press release, the next day we got $500,000 to give out. I'm asking for some grace and some consideration to make sure that we do this right so that we serve you effectively. Give the city and the nonprofits that's doing the work, give them some grace, be patient with us as we make sure you get served effectively. We may not meet 100% of your need because the money is a limited resource, right? So I just need people to have, you can have hope, but have a realistic expectation of how we can respond given limited resources. We had 3,900 requests for support. We received resources to help 450 people and families. So the response, again, I commend the city with the response, but again, if we're gonna get people served, those of us who have resources and opportunities, we should be trying to figure out a way to match that $500,000 to get other brothers and sisters served on the ground. It's not a $500,000. It sounds like a lot. After you get done chopping that up for the people who need it, it has a limited impact. And the Urban League has put other resources to try to match what we took in. It's just not enough. So again, we're in a city where this is an environmental city. This is a human-centered environment. If that is the case, then I'm issuing a challenge to Austin and Central Texas to put your money where your mouth is. If you say you love people and you want equity and you want a sustained quality of life of everybody who lives in this region, then help us match that money so that more people can get served. And I guarantee you, APH, the city of Austin, is going to hold that cohort to account for the nickels and pennies that we give out to people. And they're supposed to, because they'll be held to account, right? The city council will hold the city accountable. The people will hold this. It's a cycle. And I think we have to be realistic about what we can do in that space. The Rise Fund, an excellent idea. They funded it at a limited amount. We need to go back and invest into the community again and put resources back into organizations that have already been funded by Rise and new organizations that can do Rise Fund work. So this is a never-ending cycle. It's not a one-time thing where we can say, oh, we did something. No, the coronavirus COVID-19 crisis is not over with. And we'll have to have a sustained effort and process to get people supported and served so that quality of life does not deteriorate or diminish.
So Carmen, I'm glad you raised your hand because this is a great point that Quincy made about this is one pot of money, but how great the need is now and moving forward. So did your group get money from the Rise Fund, and how have you seen some of this? I think it was $15 million in the Rise Fund, and there are other funds coming down the pipe, but tell us about your perspective on that, Carmen.
Yeah, I absolutely echo a lot of what Quincy's talking about, because we have these systems with these barriers in place and procedures, and some of it's for really good reason, and some of it just really can get in the way, and it requires leadership at every level, community and in the institutions, to find workarounds. And I really want to applaud our city council for passing this fund, but primarily the grassroots organizations. Gotha was very involved with a number of organizations like Grassroots Leadership, and Family Independence Initiative is whose platform we're using. We've actually pushed through about $215,000 from the Equity Rise Fund. So this was the Rise Fund, but specifically $2 million that went through the Equity Office. And I'm getting texts on a regular basis. The organizers are hearing from people who have received their funding already. They were able to receive it within a couple of days. They were able to do it with dignity, without having to really parade the worst of themselves or the worst of their financial struggles, but to just really be able to self-report key data points so we can see who's getting the help and where across town, and relying on these organizations that have relationships with people in the community, regular folks who may not be plugged into everything else, but the people who are most impacted. And I'm glad more of us are saying people of color and not minorities, because Austin is a majority people of color city. But that's often not reflected in the institutional conversations that we're having. And so a lot of these organizations that were able to we're part of an experiment. We're proving out a concept that grassroots connected organizations can use this platform to get funding to people. And this needs to be a pathway for more of those funds. And we also need to make sure that $7.5 million of that 15 million goes to direct cash assistance, not just services. Because we have to be able to trust people, just like many of us were trusted with a stimulus payment, that we're going to spend money on things that need to be spent. And the other thing is that when we give cash support to people in a crisis, or who are experiencing poverty, that money gets spent right away. That's part of keeping the economy stimulated, keeping enough aggregate demand. And for them, it's a matter of keeping certain economic thresholds, not getting evicted at the end of all of this, right? Not even if the evictions pause, not racking up thousands and thousands of dollars of debt that you couldn't pay back in rent, not foreclosing on your home, not losing, certain key stability points from which it's a lot harder to recover. So I think from a practical standpoint in responding to this crisis, we're actually having to trust people in ways that maybe seemed a little bit radical, maybe 2 or 3 months ago, but now are just part of practical necessity. And I think we are collecting data that's showing that we can do things more equitably in the future. We can eliminate more barriers and give more agency to people to solve their own problems and solve problems as community, because that's really who addresses the gaps at the end of the day.
I want to talk a little bit about education. We mentioned health disparities. Education disparities is an issue that has really come also glaring to light during the pandemic, because a resilient community, in my mind, is one in which everyone has equal access to a high quality education. So AISD, this whole school closure debate, that has kind of painted this picture before the pandemic. The COVID-19 crisis has again illuminated some of these significant racial and socioeconomic inequities in our regional educational system. So going forward, how do you all think school leaders and policymakers should start addressing some of these educational disparities that we see, not just in AISD, but region-wide?
Who you want to
Start on that,
with that?
Quincy? Go
Yeah.
ahead.
So Austin ISD took a very good step in creating an equity position for the district, but that's about 25% of the way. What they have to do is go ahead and fund the equity office for Austin ISD at 100%. That way, the talent that they have there can actually bring in the talent to investigate and assess equity and help plan and define equity broadly in the different areas of the district, from administration to instruction to student recruitment, student retention. They have to empower the office to actually do equity work. It's one thing to have an equity position. That's surface level. On paper, checkbox, it looks good. You did what you were supposed to. Now, take that position from under the superintendent, whoever he or she will be when they choose a new one, and make it a board position so that it'll have the autonomy. That office will have the autonomy and the authority to actually assess and implement equity change, equity improvement, equity value propositions, equity actions to get things done for the students. The most important stakeholder in this game is not the administration or the district. It's the student who is to be educated. It's the student who has to have a whole equitable education experience inside of Austin ISD. And it's something that all of the other ISDs in the area should model. So I'm calling out Austin ISD to finish what you started, but also to the other ISDs, Pflugerville, Round Rock, Maynard, Dale Valley, Georgetown, Round Rock ISD, do your part and structure an equity office to do that actual assessment to see our students actually getting what they need. It's one thing to create programming and co-curricular and extracurricular activities, and on the surface it looks like it's accessible and it's equitable and students can get involved. But it's another thing for a student to have to pick up, and a family to have to pick up the residual cost of participating in those extracurricular, co-curricular activities. That's a way to exclude. I have it available to you, but maybe not, because financially you can't afford to participate. I have it available to you, but you don't meet the academic criteria to have access to this. So again, that's where the equity office will come into play. They can assess everything top to bottom and define and have a practical solution to how to implement equity in the district. Don't just create the position, don't just create the office. Get out of the way and let equity happen the way it's supposed to, if Austin ISD truly intends to be equitable. It's a good first step. I give Dr. Cruz credit, even though he's on his way out. It's a good first step. But again, there's these backroom happenings where that position may be left out of conversations where equity should have a voice and action at the table with the board. I know they're going through a search right now, and I'm making sure that the voice of equity is represented in that conversation by communicating with the search firm and hammering equity all day. The community cannot let up on equity being included in any conversations about Austin ISD moving forward, whether it's school closure, whether it's repurposing property, it's anything, whether it's the design of new curriculum, the implementation of hiring practices for new teachers, the education of new teachers, the training of administrators. Equity has to be at the core of all of this for Austin ISD to move forward in a way given the historical context by which marginalized communities, people of color, I will say minorities, have been handled. They have to become fearless in being equitable. They have to be fearless.
Mark, I saw your hand go up. Did you want to chime in on the education question?
Yeah, just a little bit. And I'm certainly not any sort of an expert in education, but I'm just going to put a pandemic lens on this. This pandemic's not going to be done for a while. No matter what you're reading in the paper and case counts and all of that, we're not going to be done with this. Summer is beginning, and I guess that's a break for the school districts to figure out what they're going to do in the fall. And that's an ongoing conversation. But I will offer that I think it is a fair to high likelihood that we end up having to go back to school from home again, whether that's the way we started in August or whether that's where we end up when the flu season gets here in October, November, and we have COVID and flu at the same time and can't tell them apart very well and don't have good treatments for COVID yet and don't have a vaccine for COVID yet. I think we end up back in this world of kids aren't going to school and they're having to get their educations from home. And in that world that we've all become accustomed to of late, understand that children in marginalized communities struggle to get a better education from this home perspective than children who don't live in marginalized communities. I will offer, I have 4 or 5 different devices in my home that can do a Zoom meeting. If my kids need to be on a computer, they can all be on a computer in a different room of the house. That isn't the reality for lots and lots of kids in marginalized communities. They're lucky if they have a device that was issued by the school, and whether they have reliable high-speed internet is not a given. Whether they have the other resources necessary to get a good education remotely is absolutely not a given. And so this equity issue more acutely rears its head in what we're having to deal with in this current pandemic state. And so even as I think Quincy's points are all spot on in how we've got to go think about this moving forward, there's an acute problem as well. Kids are having to get educated at home, and that doesn't happen equally either. And the school districts and everybody else is going to have to give some consideration of that. It's a big problem.
I know that the school district has set up, the AISD has in fact set up some hotspots with school buses where families who don't have internet connection can go so their kids can get their schoolwork done. But you can imagine that extra burden placed on the family to have to be able to do that just to get internet access. Carmen, I'm wondering if you have something to add to this whole discussion about families and education and where that intersects with access to healthy foods. A lot of kids depend on going to school to get a healthy meal, and that's not happening. So talk about it through your lens.
Yeah, I think that I want to give kudos to the food service leadership at AISD and also the food systems folks at the Office of Sustainability in City of Austin. I'm thinking of Annalisa Tanner and her entire staff and Edwin Marty and his crews, because they knew from the beginning that the immediate response was not fully equitable. So for example, having AISD meals available, curbside pickup, that was great, and excluded people who couldn't access curbside pickup. Again, we saw some of those systemic bureaucratic rules coming in where all children in the family had to be present in the car in order to pick up a meal, which is just impractical and inequitable on so many levels. And then also a real sort of strictness about meals being for kids only. And so I really want to commend Council Member Kathy Tovo for her recent successfully passing unanimously a resolution last week at City Council to provide caregiver meals so that some of the caregivers of these children can actually get meal service as well. And just understanding that this is an extremely tough time right now. There's always a disparity. This is a very difficult city to get by in if you're working class and to keep up with the increasing cost of living. But we also have to recognize that we have people who are out of jobs right now and trying to get food on the table. And so it took a lot of workarounds and figuring out how to deliver. I know there were a lot of, this is what you don't see and hear about, but again, the community and neighborhood networks, principals, parent support specialists who were taking leftover meals to households in the community who couldn't get them. That's a lot of people who were filling those gaps. Families distributing food among each other. I know for the organizers for Gotha, they've seen a lot of families feeding each other just informally. So a lot of changes were needed very, very early on to remove some of those barriers and find some workarounds. And then on the education and devices piece, this is another place where cash assistance, it can be really helpful. Google Fiber actually donated $5,000 to Gotha to pass through 100% in $500 cash payments to families who need a device, but AISD was distributing devices and ran out very early on. It was very difficult for the city to respond to people's technology needs. And it's not just devices people need. I mean, you all are talking about it. I know before we got on this call, all of us had to turn off Wi-Fi on everything else so that we'd have good reception. What happens when you have 2, 3, 4 kids at home who need remote learning and you're supposed to be working, and then heaven forbid you want to give testimony at a city meeting or a public hearing, you're going to have to be on phone waiting for probably hours to try and chime in. So we all have limited bandwidth, and Google's funding for us to do cash assistance allowed us to pay people. You need to buy your kid a tablet, buy them a tablet. You need a better data plan for your shared phones, get a data plan. You need a completely new Wi-Fi connection or internet service, get what you need to get. And I'll share a very inspiring quote from an anonymous teacher that I love, which is where they're reassuring parents, don't worry about the schoolwork because I can get your kid back on track. As a teacher, that's my superpower. But what I can't fix is the social emotional trauma that inhibits learning. So I need you to share your calm with your kids, your strength with your kids, and do whatever you can to get them through this hole so they can catch up with the schoolwork later. And I think that's really ultimately, that's why we just need to take care of people's basic well-being so that we can figure out the recovery in the way forward. But let's not let go of those systemic equity issues, as Quincy mentioned, and with Dr. Holly at the district, there are a lot of things that need to be addressed during and after this crisis.
What a beautiful, poignant quote, Carmen, for all of us to remember in so many different aspects. That social emotional well-being is so critical to moving forward from this picture, and certainly while we're in it. Courtney, I believe, has a question from one of our audience members. Courtney?
Yes. So there's a negative connotation with the term vulnerable communities because it feels like labeling certain community groups as having some sort of deficiency. What is your take on this term as it relates to communities of color and communities that are historically marginalized?
Quincy, take that one.
So at any time, any community can be a vulnerable community. It's contextual. And again, we all look at things through our own lens. So I would encourage us to be, again, engaging in conversations like this. You see multiple contexts from myself, Carmen, and Mark to talk about vulnerable communities and how each of us as leaders of human service organizations, civil rights, health, and another health organization, we have to contextualize it. Any of us can be vulnerable at any time, given the context of what we're vulnerable to. So in a time like this, as leaders of nonprofits, there's a reason we all had to apply, and I hope we all received the payroll protection program resources, because we were vulnerable. We were a part of a vulnerable population because of how the COVID impacted our ability to fundraise and sustain the work for the people who we serve. they were a vulnerable population. It's contextual. When we look at it through a lens, you can have a negative perspective, or you can take it into context and say, oh, we're actually all vulnerable for something. Because if on the west side of Austin, you walk into a community, into a HEB where somebody who has the corona or COVID-19 has been, and we don't know anything about contact tracing, and we go in there and we encounter an environment where the corona has been, at that point, you are vulnerable. Even though you live in a community where you may not think you are vulnerable, you are vulnerable. So we have to contextualize it and don't accept the negative energy that comes along with certain connotations and certain uses of certain phrases or words. We have to elevate beyond that if we can, and contextualize it. A vulnerability for somebody living under an overpass doesn't look like a vulnerability that I might have living in a house. So again, I want us to elevate in our human circumstance and contextualize it, so that way we don't get caught up into, well, that person, and I'm a straightforward person, that white person or that black person called us vulnerable. We're all vulnerable to something. Let's contextualize it and not buy into that negative energy surrounding the use of certain terms for certain communities, certain populations, certain groups, certain individuals.
Before we get to our call to action, I want to save a little time at the end for that. I want to ask you all about the whole reopening process and look at that through the equity lens, because as of, I think, next Monday, that's going to expand in a big way across the state. What are some guidelines that you think the decision makers and policymakers, if you will, should implement or enforce to support vulnerable communities, if you will, marginalized communities, as we begin to reopen?
Speak to that one.
Carmen?
I appreciate the nuance and the digging into this, because I think we can talk about risk and we can talk about who's most impacted. And we have enough data now to make some statements about who's most impacted by this virus at a health level, who's dying, who's being hospitalized, and who's disproportionately exposed. And I think that when our state leaders make the decision to reopen, when the federal leaders, allow that to happen, after we've seen who's dying and who's being hospitalized, it sends a really clear message to some of us that unfortunately underscores a lack of care for certain lives under others. And it's really unfortunate, but it is on us as community to take care of ourselves and each other now, and to push our institutions, push our governments to definitely, protect us more. But we have to understand that when economic goals are placed above human life, we really need to pay attention to who's being impacted. And right now it's disproportionately people of color, specifically African Americans and Latinos in ways, similar ways, but the impact on Black communities in particular is really devastating. And certainly elders, and certainly people who deal with other issues because they are low income. And so we have to recognize racism, classism, and ageism, how they impact our health outcomes in general, and how that is magnified in this crisis. And public health is no longer, an extracurricular for a lot of people. For some people, it's been a profession, but for others, it's sort of been this other sort of proactive kind of nebulous thing. This is absolutely key to our coping with this, but also recovering and making sure that, the world we enter after this portal that we're in, that we end up not in a more inequitable place, but a more equitable place. Every institution, every decision maker, grassroots to grass tops, needs to be asking themselves at each moment, is this going to increase the inequities, perpetuate, or is this going to build more racial equity, more health equity into what we're doing?
Mark or Quincy, before we go to our call to action, do you want to weigh in on that question?
I'm just going to make a quick comment. You know, the social distancing, the guidelines that are being developed and are being used to drive the reopening of the state and other states boil down to their most essential notion. It's love thy neighbor, right? I wear a mask because I'm protecting you from the possibility that I might transmit something to you. We socially distance and stay 6 feet away from each other because it is protective of you and I make a decision to stay in my home if I'm sick so that I don't bring it out and possibly give it to everybody else. I would like to believe we live in a world where people would make those decisions out of love for their neighbor. I'm not that much of an idealist. We know that people will make decisions other than that, which is the purpose of government. So government sometimes has to put guidelines in place that help people do the right things, engage in the right behaviors. Government has to be willing to enforce the guidelines they put in place. So if they're not going to enforce the guidelines, and we've seen that in other states, we've seen backsliding on guidelines. Even as they're released, then they begin to back up again because people want to complain about it. If we're not willing to do what it takes to stop and slow the spread of this virus, we're going to be dealing with this pandemic for a really long time. And that's just a realistic view of a doctor who knows how viruses work. And the viruses don't care about whether you need a haircut, and they don't care whether you need to go to a bar. The viruses don't care. They just need humans to get in close proximity with each other so they can jump hosts. That's all it's about. So if we're not willing as a society to do the things necessary to slow the spread of this disease until we can treat it and prevent it, then we're going to get what we choose because of our behavior. I'll stop there.
Quincy, why don't we do this? If you could weigh in on the reopening question through the equity lens and what you'd like policymakers, and then if you wouldn't mind segueing into your call to action, that would be great, because we're running out of time. So I just want to make sure we get those calls to action into. So go ahead, Quincy.
Really quickly, I challenge our elected or appointed bureaucrats to have the courage to understand the balance between the need for economic reactivation and protection of the public health. I don't envy the position that they're in. Some of them, they make piss poor decisions based on variables that are personal to them without understanding you're a public servant. But again, I challenge the bureaucrats, both the elected and the appointed, do what's in the best interest of society as a whole and not what's in the best interest of those who will economically benefit from reopening. And there's balance. You have to bring a balance to it. My call to action for all of those individuals within the sound of my voice, the viewing of the screen of me and my colleagues here, get involved in some kind of way to help mitigate the negative impact of the COVID-19 coronavirus. That can range from making PPE and donating it, to donating financial resources, to donating your sweat equity to some type of cause. You have to determine what your risk is and what you're willing to take on from a risk and how to get involved. But there's ways you can get involved doing the shelter in place. The whole proposition is to get involved and help us bring resolution to some of the challenges our brothers and sisters face on the ground who don't have access to resources and opportunities. Find a way to get involved and support a response that supports people. Thank you.
Great call to action. Mark.
Man, it's hard to follow, Quincy. You know, I would stress people, love your neighbor and think about what you do as having an impact on everybody else, whether it's the people that live next door to you, or the people that live across town, or the people that live in New York and California. You know, we are interconnected as human beings, and none of us live on an island, and the choices we make affect all of us. And so, you know, I echo Quincy's comments: get involved. What you can bring to the table will help somebody. And maybe that's your whole thing, is you're going to help your neighbor next door get their groceries. Maybe that's what you can do. Well, then do that, because it needed to be done, and there will be another human being on the planet who will be appreciative and helped by your efforts. But whatever it is, you can do something. But just love your neighbor. If you can think about it through that lens, you'll figure out what the right thing to do is.
Love your neighbor. It sounds simple, but boy, it does give that broad message that we all need to hear right now. Carmen, you're last with your call to action.
Well, I love thy neighbor, and it's a good time to know your neighbors. I was been talking about this with my parents about how good it is to know the people on your street or in your apartment or whoever's around you. And I've been telling people, if you don't know your neighbors, you're not going to be in the head count. So when the crisis hits, right, you want to be on somebody's list, right? And that's why we got to look out for each other. But I guess my call to action would be for leaders, community leaders, organizational leaders, institutional leaders. I've been honored to be a Fulcrum Fellow with the Center for Community Investment, and one of the great pieces of leadership advice that we've been given in this crisis is 3 things. 1, self-care, which part of that is conserve energy. I think in the first 2 weeks of this, our heads were spinning, and I had to have some really real talk moments of reflection with myself and my own leadership team that there could be 12 weeks. We might be looking at 6 months of this. We're going to be looking at probably 18 months till things even start to become less unpredictable. So conserve energy, don't burn out now. 2, try to get the balcony view. You know, save a little bit of space and quiet to think about the big picture of what we're all doing, because we're having to respond so much in real time to new information, new problems, new opportunities. Try to zoom out, take the high level, and reflect on really what's possible. And the 3rd is really the possibilities. What opportunities exist in the middle of this crisis? There are certainly a lot of things that could get worse in this crisis. And there are too many opportunities to shift this world to a more just and equitable and loving society that we want to celebrate. So keep in mind the opportunities and connect. Lean on your networks. Pick up the phone. It's amazing how connected we've managed to be during this time of so much physical separation.
Wow, what a great discussion this morning. And we made Leadership Austin history. We had our first virtual engaged breakfast. Nobody had to fight traffic. Nobody had to worry about parking. I could kind of get used to this. I don't know how everybody else feels. We do have a quick reminder before we say goodbye. The next engaged breakfast is Wednesday, June 3rd at 10 a.m. via Zoom. Virtual variety, right here on Facebook again. The topic is going to be regional impact, a conversation with city managers. Our guests include Saranaya Breland, the city manager of Pflugerville, Chris Shorter, assistant city manager of Austin, and Scott Seller, the city manager of Kyle. Lastly, and most importantly, I want to thank our 3 panelists today for all that you do in the community and the great perspective you gave all of us, such wonderful food for thought, and also being able to see this pandemic through the equity lens, which I think is so important right now. So I'm going to give, and I encourage everyone watching on Zoom to please give our Facebook a muted applause. I hear it loud and clear right now. So thank you all again, Carmen, Mark, Quincy, great perspective. Thank you all out in the audience in virtual land. We appreciate all of you. We will see you next month for the next Engaged Breakfast. Take care of yourselves and each other.
Thank you.